In this video, we're going to talk about why you should never get your gallbladder removed unless you absolutely positively need to. Today, I'm going to talk about 6 lies that the surgeons will tell you that you need to know the truth about. I'm also going to get into the best foods to consume if you have a gallbladder problem. Well, what is a stone? It's a high level of super concentrated cholesterol with a very low amount of bile salts. And then that equals a formation of a gallstone. So in reality, stones come from a lack of bile. Let's now get into certain lies surgeons will tell people that are absolutely not true. But let's start with number 1. There are no other options when you have a gallbladder issue, right? Your gallbladder is killing you. You need to remove it. There are no other options. That is a lie. There are other options. You have oral bile salts. That's right. Just taking bile salts. In one study I read, 50% of the people had the gallstones dissolved within 2 years. In another study, it was just under 80% within 6 to 12 months. There's other forms of therapy too. Here's one, EDTA. This is a chelator. A chelator means claw, and you can take it and it connects to calcium and other minerals, and it locks it up and it pulls it out of the body. And I do want to emphasize this, the oral bile salts have very little side effects, especially compared to the removal of the gallbladder. There's also another alternative, mechanical extraction of the gallstone without taking the gallbladder out. I'm not saying that you shouldn't do surgery under certain circumstances because it could be life-threatening. You need a complete informed consent where you know all of the options and all of the risks and all the side effects. And the last one is lithotripsy. This is using sound waves to break down the gallstone. Number 2, a gallbladder that makes gallstones is diseased. Is it really a disease? Or is it a symptom of something else? Does a doctor ever tell you what causes gallstones? Unfortunately, they don't get a lot of information about food therapy, especially in relationship to how that affects the gallbladder and the bile release. And so that's why I'm doing this video. Number 3, you cannot prevent gallstones by the diet. So let's say, for example, you're getting some consultation with a doctor and you're asking about diet, and they tell you that diet really doesn't have a lot to do with it. Well, then I would ask them, what does cause gallstones, right? How can you be so convinced that the root cause of a gallstone can't be related to the diet when the gallbladder and its bile is part of your digestive system? What else would cause that? It's kind of like common sense. Number 4, removal of the gallbladder does not result in complications. What are some of the common symptoms? Diarrhea, gastritis, depression, anxiety, increased risk of cancer. If you have your gallbladder removed, your risk of colon cancer goes up by 11%. The risk of liver cancer goes up by 60%. The risk of pancreatic cancer goes up by 22%. And the risk of bile duct cancer goes up by 45%. And the question is why? Well, when you have the gallbladder removed, now we no longer have a regulation of that concentrated bile. But one of the big ones is bile acid malabsorption. That usually occurs because we have now a situation where we have excess bile draining from the liver into the small intestine. So now you're put on a medication that tends to slow down the bile release. And that's not without side effects, because now the side effects from that are constipation, a whole series of other issues. Number 5, post-cholecystectomy syndrome is controversial. No, it's not controversial. Look it up in Wikipedia. There's a lot of problems when they remove that gallbladder. Number 6, even if the gallstone results from pregnancy, you still need the surgery. Now, if someone tells you that, I would definitely get a second opinion, because estrogen has a huge influence on the gallstone. And as soon as you get through your pregnancy and estrogen normalizes, is the gallstone going to stay there, or is it going to go away? Same thing with birth control pills, right? You have this spike in estrogen and all of a sudden you end up with a gallstone. Well, it's estrogen. You have 2 different types of bile. You have the bile that's made by the liver, but you also have bile that's made by your microbes. Anything that destroys the microbes, as in an antibiotic, can also affect your bile. When people get an antibiotic, they're more at risk for a gallstone. When people get an antibiotic, they gain more weight because one of the symptoms of the removal of the gallbladder is weight gain, which is fascinating. Another cause of lowered amount of bile is going on a low-fat diet or a low-cholesterol diet, because guess what makes bile? Cholesterol. That's where it comes from. And if you're not putting any cholesterol in at all, you could be deficient and you're not going to be able to make bile. This is why people that are on a low-fat diet are more at risk for a gallstone than people that are not on a low-fat diet. Fascinating. And this brings up another question. What type of fat encourages the liver to make more bile or synthesize more bile out of all the fats possible? Because there's a lot of different types of fats. Well, apparently it's fatty fish that have the most potent effect on the bile production, which is, it makes sense from an evolutionary standpoint, because in that fatty fish, you have something that's super important. DHA. That's an omega-3 fatty acid, but there's other fatty acids too, from meat and even olive oil. Of course, I would not recommend the seed oils because that's going to create inflammation. But the other thing that triggers the liver to make more bile is cholesterol foods. Butter, eggs, shellfish, seafood, liver. And it just so happens that egg yolks and liver are high in choline. Choline is another key nutrient to help make bile. In fact, if you took choline as a supplement, it's kind of like taking a type of bile to help you digest fats. Now, we talked about the liver, but are there things to help you contract the gallbladder so you can stimulate the gallbladder to release more bile? Well, that would also be some of these fats I talked about and proteins, but also other things too, like bitter greens, arugula, radish, even celery. Maybe add some sauerkraut to increase the bacteria so you can make additional bile salts to help purge that bile and help you digest. Even also the citrus, like in lemon and limes, can also help purge that bile too. And taking more acid, and as an apple cider vinegar or betaine hydrochloride, can also increase the acidity, which will then trigger the release of the bile from the gallbladder, because you need a strong acid in your stomach to be able to trigger that. And a lack of acid could be the reason why things aren't flowing through there as well. So in other words, your stomach problem is causing the gallbladder problem. So you really have to kind of connect the dots. Certain herbs can also increase the contraction of the gallbladder, like turmeric, ginger, milk thistle, parsley, cilantro. And as a side note, if someone goes through a lot of chronic stress, they're going to have more cortisol. That's going to shut down the bile too. If they took a synthetic version of cortisol called prednisone, that can shut down the bile salts as well. Now you have a diet that's actually really, really healthy, not just for gallstones, but to support your gallbladder. But I just challenge you to investigate and do research on maybe consuming bile salts after each meal, something like TUDCA and purified bile salts.